Hello, I'm Dr. Cossack. When selecting a lens for cataract surgery, I am often asked several more advanced questions. Number 1, how far away is near, intermediate, and far? These are ranges of distance which can be customized. Near is often centered at 16 inches, intermediate at 32 inches, and far is anything beyond 10 to 20 feet. The light rays from objects beyond 20 feet are essentially parallel. Thus, the focusing power to see across a large room is the same power needed to look a mile down the road or at the moon. On the flip side, the angle of light from a near object like your cell phone differs greatly when held 1 foot in front of your face compared to 3 feet. While a 20-foot far target gives great vision at 10 feet and 1,000 feet, a near target of 1 foot doesn't give very good vision at 3 feet and gives terrible vision at 20 feet. This is often why patients select a far target, to get more range for their money. Additionally, patient factors come into play. Small pupils create an always in focus effect, like a pinhole or autofocus camera. Often those with longer eyeballs, who have been nearsighted, have great depth of focus. Others can have very limited depth of focus. Number 2, what is a diopter and how does that relate? Diopters refer to how much power a lens has to focus or bend light. Different power lenses allow us to target near, intermediate, or far vision. When images far away are in focus, 2.5 diopters of lens power are needed to focus light at near or 16 inches. Therefore, a plus 2.5 is a common strength for reader glasses. To change focus from far to 3 feet, only 1 diopter of power is needed. The conversion is based on the metric system. 1 diopter focuses at 1 meter, whereas 3 diopters will focus at 1/3 of a meter. Number 3, how will my eye change in the years after surgery? This is an excellent question and an important point to consider. Your eye will continue to have subtle changes in its focusing strength in the years after surgery. This is due to changes in the cornea. These changes could occur in either direction, shifts of more nearsightedness or more farsightedness. Thus, the standard practice for targeting far vision is not to aim for pure optical infinity, but instead to aim very slightly in from that, perhaps a 1/4 diopter. This utilizes your depth of focus to still see far, but also give better intermediate range vision and to guard against aging shifts of the eye toward farsightedness. A pure distance outcome seems the most exciting as you recover initially, but a very small degree closer range, while still being a far target, is actually the best outcome for the long run. 4, what is astigmatism? Astigmatism is when light from different directions is focused differently. Light oriented up and down may be focused more strongly than light which has a horizontal orientation, or vice versa. If your eye focuses all orientations of light at the same point, then you don't have astigmatism. In reality, almost everyone has astigmatism, and the relevant question is how much and what type. The cause of astigmatism is having eye structures that are football-shaped rather than round. If you were an ant crossing the football from side to side, it would seem much steeper than if you crossed it from end to end. This sort of shape in your eye causes light oriented in different ways to focus differently. Your natural lens, which becomes the cataract, can cause astigmatism, but given we plan to remove it, the relevant question is how much astigmatism is caused by your cornea in the front of your eye. This is measured before cataract surgery. You will still have your cornea after surgery, and it will still cause astigmatism. In some cases, your cataract may even have canceled out your corneal astigmatism, and it can come as a surprise to be told you have astigmatism to consider. If you have a lot of astigmatism in your cornea, we can special order a football-shaped toric lens to cancel it out. The alternative is to cancel out the astigmatism with glasses or with contact lenses. Glasses can do this in a much more precise manner than a toric lens. Unfortunately, some patients have neither a spherical cornea nor a football-shaped cornea, but instead have a bumpy, irregular cornea. In these cases of irregular astigmatism, a toric lens may not be helpful. 5, how do multifocal lenses work, and why aren't all lenses multifocal? A standard lens works to focus light at a particular point based on the lens strength and its position. In most uses, a lens would be considered defective if the light was not brought to a single focus. However, your near world and your far world are at different distances from your eye. Therefore, lenses have been developed to focus light from both these distances simultaneously. Multifocal lenses split the available incoming light. This means half your available light is being focused at far, with 1/4 of the light at near and 1/4 at intermediate. Thus, multifocal lenses are only advised for patients who strongly desire less reliance on glasses and are not advised for those wanting the most pristine vision quality. The distance vision is located in the center of the lens, which means that in bright lights, when your pupil shrinks, the zones for near and intermediate are blocked by your iris. Thus, patients with larger pupils do better with these lenses. Additionally, conditions like macular degeneration or glaucoma limit our ability to implant a multifocal lens. 6. What color is the implant? Should it match the natural lens with which I was born? The standard implant lens is clear. The lenses you had your whole life had a slight yellow tint to it, especially as your cataract progressed. This means humans who have had cataract surgery can actually see wavelengths of light at the violet end of the spectrum, just outside of what is considered visible light. Patients often notice this with bright fluorescent lighting in stores. In general, this is a good thing, but if you wish to replicate the very slight yellow tint you've had your whole life, or to match an existing lens already placed in the other eye, there are standard lenses available to do that at no greater cost. Many patients would not be bothered if we implanted one clear on one eye and one yellow on the other. The effect is that subtle. If you have any further questions, please let us know.